Thanks for staying with us right here on Sunrise as we continue this Hope Day Wednesday in our health slot this morning. If you are a woman, your chance of getting urinary tract infection or UTI is high, and some experts rank your lifetime risk of getting one as high as 1 in 2, with many women having repeat infections, sometimes for years on end. Now, we invited Dr. Marlon McKay to tell us on how to handle UTIs, whether you are experiencing your first or your 5th infection, and how to make it less likely if you'll get one for the first time. Well, of course, you at home can be part of our conversation as well by calling in on 011 447 1742. or 011 447 1620 if you have any questions for the doctor this morning. Good morning, Doc. How are you?
Good morning, Penny. Thanks. Nice to be here.
Thanks for joining us once again. So now, why is UTI common mostly in women?
I think the simple term is anatomy. It's the way women are designed and created. A few things. One, remember, UTI is an infection, which means it's caused by a bacteria. So the bacteria has to come from somewhere, and it usually comes from the digestive system. Okay, and the commonest organism is called E. coli. So it comes out when you go to the toilet to make number 2, when you pass a stool. Now, because the anus is so close to the vagina and the urethra, that close proximity easily allows those bugs to navigate from the back to the front. And that is why we always encourage women, when you wipe from the front to the back.
Yeah, okay.
Very important. And then also the women also have a shortened urethra. So the urethra is the tube that takes urine from the bladder out, and it comes out. So that short tube also allows for infections to travel quickly from the vagina or from the urethra up to the bladder, and then causes an infection. And because those two factors are present in women, it is much more common. It is not to say that men don't get it, but it's much few and far between compared to women.
Okay, so if somebody asks that, so does that mean that urine can contain like infectious organisms? So
by nature, remember your urinary tract, so the kidneys are responsible for filtering the blood and making the urine. The urine then travels down the ureter to the bladder and then out. Now, all that whole process is sterile. So under normal circumstances, your urine, even though it's considered a waste product, is actually clean. It has no bacterial organisms. And so therefore there's no inherent infection in there. It's when it happens from outside, and these bugs, as I mentioned, either from the colon, from the anus, or even during sexual intercourse. Again, because of the act of sexual intercourse, where the vagina and the urethra are so close to each other, external organisms can come out, and then it enters into the urethra, into the bladder, and then you get the infection. So it's not really the urine that causes the infection in the first place.
So another question, if someone who is pregnant discovers that they have a UTI, I mean, what should they do? Okay,
so UTI in pregnancy is fairly common, but is much more serious because it can affect the delivery of the baby, the development of the baby, the blood pressure of the mum-to-be. So any UTI in pregnancy is considered a complicated infection and an urgent infection, and that needs to be treated by a doctor. So we encourage the women, if you feel any symptoms, to get to your doctor or your gynae, have the urine tested for which particular organism it could be, and then to be put on the appropriate antibiotics if there is a documented infection.
So can we talk about those symptoms?
Yes. Yeah. So remember, your bladder's at the bottom, so immediately you will get lower abdominal pain, and then because the urine is now has an infection, there are urinary symptoms. The most common one is burning. So every time you go to the bathroom, you get that inherent burn as the urine passes. You may have frequency of micturition. In other words, getting the urge to pass urine more often. And then many women will complain that even when I go to the bathroom, just little drips come out, drips and drabs, and I have to go back again. And also you may find blood in the urine. If it's going up to the kidney, it's a much more serious infection, and then you'll get systemic symptoms, which can be with nausea and vomiting and a high temperature.
Are there different types of UTI? Or
so the common one is a bladder infection, which you call a cystitis, and then a kidney infection, which you call a pyelonephritis. Then you can have an acute infection, which just comes, And you can have recurrent infections, like you mentioned in your opening, where women get these infections over and over again. And so those are the way we'd usually classify them. And some of the more complicated ones will be the organisms that are unusual, especially if there's a catheter involved or the person is in hospital, spinal cord injuries. So you can get different types of infections.
Okay, so there's a lot of like over-the-counter medication. Can we talk about that and when it comes to treatment?
Yeah. So remember, if you have a documented bacterial infection, in other words, an E. coli, antibiotics are your the only benefit. Now, there's a lot of discussion around cranberry juice, for instance. Okay. So if you look at the studies, cranberry juice has a molecule in there called the tannins, and that seems to prevent the bacteria from attaching into the wall of the bladder. So this discussion comes out, is it okay for prevention? But most of the studies will show that you need a lot of cranberry juice to get enough concentration to do that. And so the harm of all that sugar intake probably outdoes the benefit of it. So if you're going to drink cranberry juice, it probably won't do that much harm, but don't think it's going to be that effective in preventing. So the jury's still out, but most of the bigger studies show it's probably not of much benefit. The other issue of there's some molecules that tend to alkalinize the urine, again, may relieve some symptoms, but don't do anything for the actual infection. So at the end of the day, it has to be seen by a doctor, examined, investigated, documented, and then treated with antibiotics, appropriate antibiotics, and if necessary.
I just got this one from control. Is there a connection between UTI and thrush?
No. So remember, thrush is a vaginal infection, okay? But obviously, if it's ongoing and then becomes a bacterial infection, it may then go into the urethra and cause a UTI. It may also present as symptoms of a UTI. So there may be burning, there may also be frequency. But unless there's actual bacteria in the urine, which a doctor must test for, it's not. So the two can often be confused, and antibiotics can be given unnecessarily for that.
Okay, well, we're taking your calls as well. We've got Pindile calling in from somewhere out in okay, looks like we've lost that caller. Okay, so prevention, you spoke about this cranberry juice story, so, but what is
so certain tips as far as prevention is concerned. We always talk about don't try not to hold your urine in too long. Obviously, keeping there can expand the bladder, can cause incontinence, can rupture. So as soon as you feel the urge to get to the bathroom, go. And I know it's a problem with our kids at schools. They're not comfortable using the public toilet system and things like that. You can't get it from a public toilet. Please just remember that. Also, we always advise that we mentioned about the wiping from front to back. It's very important straight after sexual intercourse to go to the bathroom and to urinate. Okay, drink sufficient amount of liquids. Be careful with, it's better to take a shower than a bath. And some of the underwear, because the water, you're sitting in the water, which is potentially can harbor bacteria and then can enter into, where the shower will just wash it off. There's some data on also tight-fitting clothes because of the moisture. Tampons versus pads. Tampons are usually better, and those sorts of things.
Okay, so those are some of the things that you have to look at. Obviously, I guess you also have to sort of like be in touch with yourself to know, pay attention. If I'm wearing these jeans, this happens. If I wear this underwear, I use this soap, this happens. Then you start eliminating.
Yes, especially with recurrent. Because the first thing, I mean, we don't want, it's not nice for us to prescribe antibiotics over and over. So if we do find a patient who comes and says, doctor, you know, in the last few years or few months I've had recurrent, then you want to go into their lifestyle and discuss what could be the potential trigger or way that the organism is getting. And so we'll cover all those bases and make sure that you're not doing something that could potentially put you at risk of another infection.
So Pindi's back on the line. Hello, Pindi.
Hi, how are you?
Good, thanks, and you?
Good, thank you. It's so nice to speak to you. Doctor, I have a question for you.
Yes, go ahead.
Doctor, I've had this problem of where I would get like burns on my vaginal parts. I wouldn't say it's warts or anything like that. I went to the doctor once and they did this infection thing, and I was clear. I even did a pap smear and everything. However, as time goes on, I have this pain which is like a small little warts, and it burns, and it takes for like 3 to 4 days for it to clear up. How can I help myself? It's really interfering in my life.
Is it not perhaps, is it little pimples that come on that area?
Yes, little pimples that are so pricky. When I even wipe, it's so painful. At an extreme, even when I do my number one, it burns. Okay,
so that sounds like you may have a herpes type 2 vaginal infection, all right? Or what you call a urogenital infection. And what I would suggest is for your doctor to see it at the time that you have an active infection. So that you can physically see it and confirm. It's HSV type 2. You know, it belongs to the same family that gives us the fever blisters. And so if you have that, and you can treat it at the time of infection and then abort the infection. Unfortunately, it is not a curable thing, so you may need antiviral medication to prevent further attacks, depending on how often you've been getting it. But it is treatable, not necessarily curable. Okay, and that would be the diagnosis.
Okay, thanks for that, Pindi. Let's take Ntabiseng on the line as well. Hi, Ntabiseng.
Hi, Penny. How are you and the doctor?
Thanks, Ntabiseng. We're good.
Thanks. Doctor, I've got a question. I had an implant inserted in July. I had complications with it. I took it out 3 weeks back. Then 3 weeks back, after taking it out, I had lower abdominal pains. I went to a doctor and I said maybe it's hormones. And then what happened is last week I had a brownish discharge coming out. It was very itchy. I went to a clinic. When I went there, they said I've got infections. So I need to know, doctor, was it the implant that infected me or what caused me? I haven't had sex with anyone for the last 2 months. Thank you.
Okay, so just 2 things. Yes, because an implant is a foreign body, potentially in the insertion and even removal, one could introduce an infection. Secondly, when nurses or doctors use the word infection, especially down there, it doesn't always mean an STI. All right, it's not necessarily saying a sexually transmitted. We are saying it's an infection that is
area
localized,
has been affected,
infected and affected without necessarily having had sex. And it could be a fungal infection, a yeast infection, and a bacterial infection. Okay, not necessarily transmitted, but just because of the foreign body that was there. And so it can be associated with that, and then it's easily treated.
Okay. Well, Doc, thanks very much for